Hey there, thanks for joining us. It's Alicia, and I'm here again with Dr. Russ of Rockside Family Dental Care. Yeah, I'm doing good. Thank you. How are you?
Good, very good.
Good. So last week, we actually did a blog video and we talked about ways to prepare yourself for a tooth extraction. So let's say that, somebody watched that video and they were prepared. They came in, they got that tooth extracted, and now they went home and it's time for, the aftercare. What are some tips that you have for after that tooth comes out?
Sure. So we always go over that with the patient after we have that procedure. When you have a tooth out, you might wonder, hey, what am I supposed to do afterward? What are my precautions? What am I to expect? So we usually go through that. The first thing that I always talk to the patient about is, you might have some bleeding afterwards. We have some extra gauze that we'll give you. We'll go over some instructions like that. It's usually nothing to be really overly concerned about, but we prepare you for that. The second thing is, what do I eat? What can I eat? What shouldn't I eat? I'll always tell patients, obviously, to be careful in that area. If you can eat on the other side. So, say we took a tooth out on the right side and probably would chew to the left side, but you could eat certain things typically on the right side in that case, but it would be softer foods. Nothing hard, sticky, or chewy, nothing that's real sharp that's going to kind of come into contact with that area. And then I also recommend typically staying away from things that have little casings on them, like seeds, corn, beans, peas, nuts. Those are always things that you want to stay away from, because that little casing, or those that can get stuck up in the socket or around sutures if you have them. So that's the dietary things. And then people ask, what about, if I'm going to have pain? Most of the time when we do these treatments, we're very careful about how we do them. We try to do them as gently as possible. But sometimes people are going to have pain afterwards. And typically, that pain can be taken care of with over-the-counter pain medications, something like Tylenol or Advil. Sometimes we would use the Advil in a higher dosage, but typically those are going to be sufficient. Every once in a while, you would have a case where we would have to prescribe you something that's a little stronger or help you relax a little bit. So those things are always talked about. And then one of the last big things we always talk to patients about is we try to not to have them get something called a dry socket. It's probably one of the most painful things that you could have, typically even more painful than the toothache if you had a toothache. And it really is due to bacteria kind of invading that socket, and there's a couple of ways to kind of hopefully not have that happen. Number one, if you're a smoker, we really don't want you to smoke for at least 48 hours after getting the tooth out. We also ask you not to use straws or to swish real hard. If it's an upper tooth, we'd say maybe not blow your nose real hard over the next few days. All that pressure change in the mouth can dislodge some of the healing tissues in there, and then bacteria can get in there and cause a lot of pain. So those are always things that we really talk to the patient about afterwards. It's really important.
Okay. And how long would you say that it typically takes someone to heal from having a tooth extracted? I know the mouth does heal faster than most parts of the body, but does it vary from person to person?
Yeah, absolutely. That's a good question. So some factors that would cause that, if you look at somebody that's a little bit younger, they're going to probably heal faster than somebody that's, maybe in their 50s or 60s or 70s or further on. Also, people that have things like diabetes or that have some issues with their health like that are going to probably heal a little bit slower. Typically, from a tooth extraction, the healing process takes, generally maybe 1 to 2, maybe 3 weeks. Typically after the first day or two, you're going to be feeling a lot better. But sometimes that's the socket that's there is going to be a little bit more open. Now that generally starts to heal over within about 1 to 2 weeks. But like you said, everybody's a little different. Some people are going to heal a lot faster than others.
Okay, wonderful. Well, thank you for answering my question. And if you're watching right now, we hope that this was helpful. If you have any further questions, make sure that you're reaching out to the team at Rockside Family Dental Care or submitting the form below, and they can get back to any questions that you have. And if you are looking to schedule an appointment with any of the doctors, make sure that you're giving the team a call. You can schedule that up, and they'll be looking forward to seeing you soon. So thank you, and thanks again, Dr. Russ.
Thank you very much.